Yep.
Morning, everybody. This is Dr. Barrett. I'm working with Clayton Wilbur in Ocala, Florida. And we have kind of an interesting case that's had abscesses chronically on and off for about the last year. And although he doesn't have much radiographic change, our suspicion usually in this scenario is a keratoma. Like I said, the radiographs are fairly normal, but we did a venogram on him, and I won't get into the details of how that works. But if you look at this, we have some really subtle changes. Our vascular supply is different in this area than it is on either side, and we have these interesting changes along the circumflex artery. It looks a little bit like what a normal crina would be as far as having a divot there, but this is much more irregular and much larger. So what we're going to do is treat this like a keratoma. We're going to cut into the foot, remove all of that affected area. We have our surgery plan mapped out here on the foot. We have a template plate.
It's on the back of the trailer.
That's all right. So we'll take a couple other videos and photos for you guys as this progresses to let you know how it goes. Thank you. Product. I'm going to show you how I like to bandage these right after surgery. Does that show up all right down here? Or do we need the light?
We need
Better?
Yes, better.
Okay. So I use a little product called Keratoma. Works pretty good for your first few days for a wound or surgery site, something like that. Get rid of a little bit of this extra blood down here at the distal part. Spray just a tiny bit more of this back in there. All right. First layer, Telfa non-stick. Helps keep your bandage material, whatever you're packing with, from sticking to it and destroying whatever healing is done over the last few days. Just work it down in there. Next layer is these cute little felt cutouts. Tuck this in at the top. And this is sometimes where these stabilization plates are kind of nice because they'll help hold your packing material in place. Slip this under the edges. This actually all came out pretty nice for fitting up. And now if we can, we'll take a roll of sterile, half roll of sterile gauze. I think this is going to be too big. Actually, this will work pretty well. Just pack it in there so it's snug. Not crazy tight, because sometimes The excess pressure will cause an unnecessary post-surgical pain. Alright, so that's it for that part. Take some 2-inch elasticon. Come around, put a little bit of pressure on that guy. And this is a little easier if you haven't been pretending you're 22 years old again and wrestling with somebody that has more skills with you and screwing up your elbow. But we'll make do. If that's good, feel the tension. Well, you can't feel it. I can feel the tension on there. That hopefully will be about what he needs. Keep the blood down, keep our granulation tissue from forming. I'll just leave this open at the top. It will be covered. This is just sterile cast padding. And I'll probably leave this bandage for 2 days. One little tip, when you guys change these, if they're pretty stingy, which sometimes they are, take a little bit of lidocaine or carbocaine and soak your telfa, your last layer, before you try and peel it away. Helps kind of numb that, makes your bandage change just a little bit easier.
Need another roll?
Yeah.
Here, I got one in there.
I did not make it as an Eagle Scout.
I never tried because I knew I wouldn't make it.
Pull a tourniquet off. You can use whatever you want for a tourniquet. Sometimes I use a bicycle inner tube, fasten it on with elasticon. This is just simply vet wrap. Show this video to my doctor.
You're gonna get in trouble, aren't you?
And I usually don't put these guys on antibiotics. Use Banamine for a few days as needed. Most of the time they're not terribly painful. I haven't had one get infected post-op yet. Make sure they're up to date on their tetanus shot. And I don't know if I said I'll change this in 2 days. Probably 2 days for a week or two. If it's starting to dry out and keratinize a little bit, cornify, then we can go to probably every 3rd day. So thanks for tuning in. See you next time.